As we begin with the awareness program on the Omicron scare, care and aftercare, may I request Mr. Juzer Khorakiwala, President, IMC Chamber of Commerce and Industry, to present the welcome address. Over to you, Mr. Khorakiwala.
Thank you, Selby. Good afternoon, ladies and gentlemen and friends. A very warm welcome to each one of you. It gives me immense pleasure to welcome you to this very topical session. Viruses constantly change through mutation, and sometimes these mutations result in a new variant of the virus. Some variants emerge and disappear while others persist. As far as COVID-19 variants go, Omicron certainly grabs our attention. Its name alone sounds ominous. The World Health Organization classified it as a variant of concern in late November. Amidst the economic, social, and medical challenges posed by the COVID-19 pandemic currently, not only India, but also global economic recovery has been rattled by the Omicron variant's rapid rise. However, I do expect Omicron to pass through quickly and for growth to rebound in the second quarter and growth for the year to be unaffected. But I think each wave of the virus is doing less damage to the healthcare system and economy than the previous wave. In order to understand it in a better way, an elite experts will highlight about how the Omicron scare, care and aftercare. So let's hear it from our expert speakers. I'd like to welcome Dr. Ashish Contractor, Director, Department of Rehab Medicine and Sports Medicine, Sir H.N. Reliance Foundation Hospital, Mumbai, and Dr. Mukesh Batra, Founder and Chairman, Dr. Batra's Positive Health Clinic Private Limited, Chairman, Health and Fitness Committee of Indian Merchants Chamber. Before I hand over this event to the speakers, I'd like to brief you a small brief about IMC. IMC Chamber of Commerce and Industry is a premier chamber of commerce in the country with a rich legacy spanning well over 100 years of excellent service to the trade, industry, and commerce. With its membership base of over 5,000 members and over 150 trade associations affiliated to it, the chamber represents and advocates interests of over 400,000 business and industry establishments across the country from diverse sectors of industry. Through its various expert committees, IMC provides policy inputs for the government, both central and state, and is continually engaged in interaction with policymakers at various levels. The chamber is now a cradle for nurturing young talents and promoting emancipation of women through Young Leaders Forum and Ladies Wing, which have become embodiment of youth enterprise, positivism, proactive thought leadership, and movement for women empowerment and entrepreneurship. The theme for the year is Engaging Maharashtra, Building India. Once again, I welcome you all to this contemporary and thought-provoking discussion, and I'm sure there will be take-home messages for all of us. Have a great day filled in learning and knowledge, and have a great weekend. Thank you.
Thank you, Mr. Khorakiwala. I now request the moderator of this session, Dr. Mukesh Batra, Founder and Chairman, Dr. Batra's Positive Health Clinic Private Limited, and Chairman, IMC Health and Fitness Committee, to initiate the session. Over to you, Dr. Batra.
Thank you very much. Thank you, Mr. Khorakiwala, for your kind introduction, and thank you, Selby, for making this possible, and also everybody at IMC. Let me start by saying and giving you a few startling facts. Over 1 million COVID cases every day in the USA. Over 300,000 daily cases in UK. Over 250,000 in India. The present COVID epidemic has spread to over 140 countries, including Antarctica, in the last few months. Is COVID taking over our lives and livelihood once again? I'm in conversation today with Dr. Ashish Contractor on the Omicron scare, care and aftercare. Dr. Contractor is the Director of Rehabilitation and Sports Medicine at the Sir H.N. Reliance Foundation Hospital and part of the hospital's task force at the 2 centers at NICI and Seven Hills during their stay and also for the rehabilitation. I have 3 things in common with Dr. Contractor. First, we are both on the IMC's Health and Fitness Committee, and also as part of the Rotary Club of Bombay. We've been together in a lot of medical committees together. Secondly, we are both ex-Campionites, and so is Juza, even though we are maybe a generation apart. And third and finally, we are both born out of homeopathy. My father was a homeopath, and Dr. Contractor's mother is a homeopath, a very respected colleague, Dr. Shrin Wadia, who I believe is also on this chat. So thank you, Dr. Ashish, for having joined us. And we look forward to a delightful and very useful conversation with you.
Thank you so much.
Let me start with the topic today, which says the Omicron scare. How scared should we be?
Okay, so firstly, thank you to the IMC for inviting me. Thank you, Dr. Batra. Thank you, President Korakiwala. Thank you, Selby, for organizing this. I don't think scared is the right word. I don't think that we should be scared. We should never be scared, but we should be vigilant. I think there's a difference between being scared and between being vigilant. When you're scared, you normally get into inaction. When you're vigilant, you get into action. So I think that this is definitely a very serious disease. It's to be taken seriously. But I believe that today we know what works against it. And what we need to do are employ those strategies. So therefore, I think vigilance is the need of the hour. You know, you have a lot of WhatsApp messages floating around, and you have 2 types of people I've seen during this sort of pandemic. One, who kind of treated as if absolutely nothing has happened and this is a hoax and this doesn't exist. And the other who are sort of so worried or so scared that they literally haven't stepped out of the house for the last 2.5 years. So I don't think you need to be at either extreme. You know, you have these messages floating around that this is now nature's vaccine and you don't need to worry about it. That's not true. Today, we are in a position where thanks to vaccination, thanks to boosters, and thanks to this new mutant or new variation, which is less virulent, we are in a good position. So we need to be vigilant, but not scared is my message.
So you're saying really be vigilant from Dr. WhatsApp and not from the virus?
Yes, it is true.
Perhaps.
They've actually done a study showing that the amount of misinformation on WhatsApp is causing a pandemic of itself.
Yeah, so I think, listen to the experts and listen to what we are going to tell you today, rather than really what you've been hearing all this time. But I think it's the past experience which creates a scare. We've all had some member in the family who's either passed away or who's been sick. And it's the isolation and the mental health trauma also that is caused over the years. And I think it's now 3rd year running now. We thought it's called COVID-19 and we thought it'd get over in 19. Yeah. And then it went to 2021 and now we are in 22 and it still exists. So let's come straight to Omicron now. So, of course, this is the letter, the Greek letter, Omicron, and somewhere it's in the middle after having done already Alpha and Delta and all the other variants, and I hope that very soon we'll come to Omega, which is the last kind of, Greek alphabet.
Yeah.
But we are right in the middle of it now. So what is different as far as Omicron is concerned from what was the Delta variant? And how would I as a consumer, or how would people who are listening to us as patients actually recognize the difference between an Omicron, a common flu, and a Delta variant?
True. So firstly, from a technical angle, which we really won't go into in this conversation, there are almost 36 sort of variations or mutations that have taken place in Omicron compared to the original virus. So it's actually a very, very different virus. And I'll come to that when we talk about vaccines. What's more practical to the listeners are the symptoms. But the common symptoms that are being reported over the last 2 months since this has been around are sore throat, feeling of cold, so like a runny nose. People get fever, headache, fatigue. these are the commonest presenting symptoms. So I'll repeat them: sore throat, feeling of cold, runny nose, fever, headache, and fatigue. What is different from Delta is that so far we haven't seen a loss of taste or a loss of smell that commonly, number one. And two, more importantly, and this is really the most important part, we are not seeing so many symptoms of shortness of breath or lung symptoms or lower respiratory tract symptoms, which is very important. So it seems to attack the lungs less than Delta, which is extremely
so it's the upper respiratory tract more and not the lower respiratory tract. So there are less symptoms of breathlessness, therefore perhaps less hospitalization, less oxygen usage, and so on and so forth. But how do you then differentiate between a common cold?
Okay, so that's a tough one, and I'll tell you today, if you're living in Mumbai, at least, I don't know about Goa where you are right now, but if you are in Mumbai today and you say you've got symptoms of the cold, consider it to be Omicron unless proven otherwise. It's just the simplest maxim to live by. If today, in this day and age, or rather in this spell of 1, 2, 3 weeks, if you've got symptoms of the cold, consider it to be Omicron unless proven otherwise. Isolate yourself, get a home test. If you have access, get an RT-PCR, but assume it's Omicron unless proven otherwise. I just want to make one quick point here, is while we are talking about Omicron, we don't have any evidence that Delta has gone completely. So there are a few people. I had someone just about 4 days back who did complain of loss of taste and smell. So they were probably suffering from Delta. So it's not that Delta has gone away completely. So one should also be vigilant for loss of taste, smell, and breathlessness.
So it's not just the cold air that Mumbai is feeling for the last few days. Okay?
No, sir.
It is not to ignore it as just a cold. Also there's also a combination of Delta and Omicron also, which has just been found in some parts of the country. And you're correct, absolutely, that the Delta being the stronger variant, it still exists, and especially in India. So let's not ignore it. So how do we get it tested? What is the right way? Because now the other challenge that we have here is there are so many now home tests. Now home tests are not necessarily being reported. So the number of people that we are getting, and a lot of them are self-isolating themselves or not, because they are afraid, they are worried. How do we deal with this problem?
So here is my practical sort of suggestion or solution. Let me just quickly tell you how a home test works versus the standard sort of RT-PCR. The RT-PCR test is very, very sensitive. So even if there's a small amount of virus in the system, it picks it up. Now, it's possible that you have very, very little virus in the system. At that moment, you're not infectious, meaning at that point, you're not able to pass it on to someone. When you are able to pass it on to someone, you have a higher viral load. That's when the home test picks it up. So the home test is a good test, but it's got limitations. And this is the way I would use it. If I had symptoms, I would use the home test. The one thing we found with Omicron is rather than just swabbing the nose for the home test, you also need to swab your throat. So the way they've suggested is you first swab your throat, and here's the gross part, you put that same swab in either nostril. Okay, now the good news is it's your own body, but yes, it does sound a little gross. So you swab your throat, then your nostrils, and then you test it. And that's happened to at least 4 or 5 friends and family that I know. Their nose swab was negative, but when we said try the throat, it came out to be positive. So you test it. If it is positive, then not all likelihood, then it's probably upwards of 99% that you have the virus, you have coronavirus. If the test is negative and you have symptoms and you have access to RT-PCR, I would go for it. However, currently the system is a bit overloaded. So there are several labs which are running 24, 48, 72 hours late. And here's the important point. So if you've given your sample and you're waiting for 48 hours, please, during the 48 hours, assume and behave as if you've got the virus. Don't go around town meeting people, conducting your business, saying that I'll just wait for the report. Assume you have it and isolate yourself. If you don't have access to any of these tests, for a minimum of at least 5 days, isolate yourself out of abundant precaution. That's the minimum.
So there were 2 questions that came out of this. The first one is that what is really the infectious period of the virus? How many days does it take to actually, how long is it still effect from the time the symptoms come off? And the second thing is, how long do you really need to isolate yourself? Because this is also questionable now. In America, they've now made it 5 days. Of course, also because it is, kind of weakening the social strength of the fabric of the country.
Yeah.
But even otherwise, they are now saying that it's very mild and therefore 5 days is enough. In India, it's still 7 days now, down from 10 days. So what is really the right time to step out, and when do we presume or test that we are normal?
So actually, you spoke about the American guidelines. Interestingly, those came under withering criticism from a lot of the senior doctors in America, because they not only said that after 5 days step out, they did not even suggest a simple home test before stepping out, which I think they should have, because ironically, a country like US is suffering from a lack of home kits. Home kits are very hard to get by. It's almost like, contraband right now, while in India or the UK and other places, home kits are very, very easy to get. So typically you're infectious a day or two prior to getting symptoms, and you're infectious for 3 to 4 days after getting symptoms. Now, please keep in mind, these are general time periods that I'm giving you. There are people who could be infectious for a shorter period. And by that same logic, there are people who could be infectious for a longer period. So as you correctly said, the government today is recommending a 7-day period with at least 3 days being symptom-free. So if you had symptoms up to say 6 days, then I would wait 9 days. So the minimum is 7. So even if you're symptom-free, you should wait 7. And otherwise you wait longer till you're symptom-free. Now, here is something
and symptoms mean not just fever. Symptoms mean not just fever.
Exactly.
Because people are presuming that the day my fever breaks, then I can step out again 3 days after that.
Yes, that's true. But, so even fatigue, body ache, that's a big one. That's something you need to take care of. So what I would recommend is, when you start, if I may use the word stepping out of your room, why not do it gradually? Which means that when you are stepping out, make sure that every time you step out of your room, you have your mask on, even in front of family members, because ultimately they are the ones you want to protect the most. And as you're conducting your business, you work for the next week. So for 7 days, you've been in quarantine, and let's say you're out of quarantine. My practical suggestion, and again, this is not any official guideline, my practical suggestion is, for that 1 week after getting out of quarantine, behave far more responsibly, if you know what I mean, than you otherwise would. So, make sure you're not lowering your mask. Make sure you're not having meals with someone, because meal times are when you're forced to lower your mask. So go out by all means, do everything you need to. Avoid long, prolonged contact with people in closed rooms. So for 7 more days, take slightly more care. And then after the 14th period, you can, get out and be far more normal, if I might use that word.
And they also say that, it's the first few minutes which are most infectious. So when you
Yeah.
lower your mask also, and also when people are traveling, you find them eating on flight. So I suppose if you just recovered, it's better that you just keep your mouth shut, and keep your mask up, during the duration of the flight, not just for yourself, but also for your fellow passengers. I think it's very important. So I'll just, other than vaccination, I will come to that as a next question. And I know that that's a big one. What are the other, steps that one could take to prevent Omicron? Is there any way that you could prevent it?
So to prevent it is the same old stuff we've been hearing for the last 2 years. It's nothing different. I'm going to almost sound boring by telling you.
Other than being paranoid.
The biggest thing is distance, and this word or this phrase, social distancing, became an in thing. I'm happy to say that right from the beginning, at least whenever I was giving a talk and I'm hearing
Ashish, that distance reminds me of a little saying, if I may say so.
Yes.
They say, love is to absence, was wind is to fire. It extinguishes the small, it enkindles the great. So, that's about distance, So when you're far away, sometimes you love somebody more rather than being too close. And I think it's the same about the virus as well. The further away you are, the better it is. So please go ahead.
I agree. Yeah, so physical distance, and that's why I say we want physical distance and not social distance. So we need to be more connected to each other, just the way we are today. You're sitting in Goa, I'm sitting in Mumbai, and we're connected. So we need to be more socially connected. So I don't
and we have people on the chat who are from London and from Kenya as well. So,
that's fantastic.
Yeah. So we are connected with the world, actually.
Welcome. Exactly. So we need to be socially connected and physically distanced. That's going to help. Our old friend, the mask. Now, the only caveat I'll make out here is that because Omicron is so infectious, if you have access, and frankly, in India, it's not difficult because it's quite inexpensive, get an N95 mask, especially when you're in the company of other people. If you're out on your own, walking, by the seaside, no one next to you, and you have a simple surgical mask, that's fine. But if you're in an office environment, you're in a travel environment, you're in a bus, you're in a train, you're in a car with other people sitting, wear an N95. I know you want to say something. Go ahead.
I want to just say it's not just N95, it's not just a mask. It's today now it's become a fashion accessory. So,
Yeah.
you have beads hanging all over, and,
Yeah.
and most people are using a cloth mask. So how efficient is a cloth mask really? And for Omicron particularly, I think it's really not efficient.
So again, clearly the guidelines are that for Omicron, cloth masks are not very effective. If you want that style statement, wear a good fitting N95 at the bottom, and on top you wear the fancy one with the beads. That's okay. My wife has got a few of those as well. So that can be the accessory, because that's what people see, right? Wear a nice white, tight, and good fitting N95, and in front of it, you can wear that second mask, which is the accessory. So that's the second thing, distance and mask. Third is ventilation. That's something which people tend to ignore. Right through the last 2 years, whenever I go to people's houses also, and sometimes we're meeting in groups of 2 or 3 or 4, everybody puts on the air conditioning. I said, okay, never mind if the air conditioning is on, but open the window. So just simple steps like that. If you're in an office environment and 4 people need to sit in an office, keep the door open. If you have windows accessible, keep the windows open. And finally, our good old friend, hand sanitation, which we've always spoken about. But honestly, that is less important than the distancing and the masks. And all of these rest on that bedrock or the foundation of vaccination, like you correctly mentioned. So, vaccination should be a given. That's the foundation on which all these preventive measures are sort of sitting on.
So let's come to vaccination now.
Yeah.
There are so many who are, kind of, no vaxxers and nay vaxxers, including some sports persons, who are presently in the news, presidents of some countries as well. There's a kind of a lobby also, which tries to think that this is a pharma industry trying to proliferate the international market. Somebody's putting some things in my body which are harmful to me. There are kind of rumors in small villages saying that it causes impotency, So I think it's good that we clear the picture of, first of all, why vaccination is required. And, vaccination is actually based on the homeopathic philosophy.
Yeah.
So
absolutely.
it's really more than 250 years old in that sense. So let's just give us a little insight into how does a vaccination work? Very simply put, the kind of vaccines that we have today, which one do we choose? If at all there's something like a preferred vaccine. And finally, then, what is the need for a booster? And when will it stop?
When will the booster stop, or when will
the booster stop? Because, we'll come to that a little later, but I'm saying, am I really supposed to take a shot every 6 months, every 1 year? I mean, is this the way forward or what?
Okay, so let me answer it in the best way that I can.
4 different questions,
Yeah, so first of all, the vaccines that we have, Dr. Batra, are revolutionary. In the history of science, if you look at, I think, vaccines, I read somewhere started from, I think, 1880s onwards. The average time to make or to come out with a successful vaccine has been something like 10 years. This time, from the time the SARS-CoV-2 virus was sequenced, we have effective vaccines within 10 months. I think this is an absolute miracle of modern science, and I don't think enough people appreciate it and all the noise that's happening. Today, again, I was seeing statistically already, I think 9.6, almost 10 billion doses of the vaccine have been given. They're highly safe, they're highly effective. The initial mRNA vaccines in their study, their efficacy was close to 94-95%. Today, there are roughly 8 to 10 vaccines across the world which are approved.
But these figures also keep changing, and it's not clearly understood by a common person, because when they started, then they said everything is 90% preventive. Then they said it's not preventive, but it will keep you away from hospitals. Then they said, well, you may go to hospital also, but it'll be mild, not so severe. So what is the true picture?
Well, the true picture is that let's talk about pre-Omicron. The vaccines were very effective in preventing you from getting the disease, and also if you got it, it would be less severe. So it's preventing against severity, ICU stays, and even death. With Omicron, we found that because of the mutations, and again, this is a nice article I was reading, that the Omicron variant is very, very far removed from the original virus. It's called the Ancestor Virus. So on a graph, when it's plotted, it's very, very far removed. So one would have expected that because it's so far removed, we would have very little protection. The good news is that's not true. We still have a very high degree of protection. Our AstraZeneca or Covishield, which we've been using, hasn't been studied quite as much as the mRNA vaccines have been studied. And they have found that against severe disease and against death, they are still hugely effective. And here is where the anti-vaxxers also cherry pick the data. And I'll give you an example of how someone can present something the way they want to. Let's assume we have, 1,000 people in a population, out of which by today 800 are vaccinated and 200 are not vaccinated. Let's assume that out of the 800 who are vaccinated, 10%, end up getting severe disease. I'm just throwing random numbers, right? So those are 80 people. They get severe disease. Let's assume that of the 200, 30% end up getting severe disease. But because the number of unvaccinated today are 200, that is still 60 people. So the people who want to give vaccines a bad name will end up telling you, you know what, 80 people with vaccines got severe disease, while only 60 people without the vaccine got severe disease. They're not telling you that 10% got it versus 30%. So data is all about how we want to present it and slice it and dice it. And trust me, the reason why we are seeing such low numbers is also because Omicron is hitting this sort of wall of vaccinated boosted individuals. So I think it makes a huge difference. At the same time, it's not that we don't have to worry at all. Today, as we speak, on a daily basis in the US and in Europe, roughly 1,700 to 1,800 people are dying daily of the disease still. And these are places like in the US where there's excellent tertiary care available, and that's still happening. In India, luckily, the numbers are much lower. I think they're somewhere in the 200-300 per day. Your next question was about boosters. Again, from everything that I've been reading, boosters are extremely effective. They've studied various permutations and combinations. In India, the government has come out with a mandate saying that you can only take a booster of the one you previously took. So there isn't that discussion about mixing and matching. Though when you read the data, you read the literature, in Israel and other places, they've studied a combination of the Pfizer and the AstraZeneca, which is our Covishield, and they found that 2+1 is an excellent combination. When will boosters stop? $1 million question. Honestly, I do not know. But also keep in mind, in the US, for example, every year when they have flu season, which is kind of now this December to February, March, they come out and they take a new shot. Not everybody takes it, but I don't know, 40-50% of the population takes it. So in summary, vaccines have been extremely effective. They have met their mandates. And even though the new variant is very different from the original, vaccines are extremely protective, which is why we're likely seeing a very mild version, both a combination of the virus itself being less virulent and the vaccine protection, both together is why we're so far so good.
So we should really use this platform to kind of request everybody that please take your vaccines.
Absolutely.
And protect yourself and other people around you. Having said this, do you think is there anything that the IMC could do to kind of propagate this? Because there's so much of misconception. For example, even in Maharashtra, in the villages, is there something that we could do as a committee?
So I think the one good thing is, compared to the examples you gave about the, famous athletes and ex-presidents being anti-vaxxers and presidents of other countries, I think in India, at least in the mainstream, there aren't too many, if I may say so, eminent personalities, politicians, film stars, cricketers who are come out in the open and being anti-vaxxers. So I think that's great. So I think the IMC should maybe team up with leaders of industry, with maybe leaders of sport, and come out with this "let's get vaccinated" message, and those who are eligible, let's get boosted. Because today, I think the good news is the problem isn't of availability. I think they're available, at least in the cities as far as I'm aware. but it's a question of, hesitancy being there. So I think that last mile we need to cover, because at the end of the day, we're only going to be as strong as the weakest link. Parts of Africa, Botswana, they were very poorly vaccinated. So we got an Omicron. We were just lucky that it was not very virulent. It could have been more virulent than Delta. Imagine where we would be then. So I think it's not fine just to say, I am vaccinated. I think we must make sure that everybody around us, and people in the IMC are, captains of commerce and industry. So many of them are in charge of teams of hundreds, if not thousands of people. So I think they individually can take responsibility for their own workforce to make sure it is, 98, 100% vaccinated.
Yeah, making sure that at least the people who work with us are 100% vaccinated, and then they do take the boosters on time as well.
Absolutely.
That's a good point. Now, coming to the other part of it, in case you do fall sick, then what is the kind of medicine that you can take at home? I mean, I don't want self-treatment here at all. I mean, I know we cannot prescribe on a platform like this, but just, kind of general indications on what one should do.
Yeah,
number
absolutely.
one. And number two is, when should one go to a hospital? What is the right time?
I think that is a very important one, that when should you go to the hospital? So, the Ministry of Health, Family Welfare and Health came out with a nice little booklet, a PDF document in color and all, and it's been circulating around on WhatsApp. So if you have access to that, please go through it. It's really nice. And again, as you very correctly put out, the first caveat is that we shouldn't be self-treating. So most importantly, most of us living in Mumbai have a family doctor typically. So if you test positive or you suspect you have the symptoms, please, of course, talk to your family doctor and then, follow their advice. But I'm going to give you general guidelines. And the general guidelines are, symptomatic treatment has shown to be very effective. Paracetamol is a big winner during this time. And
absolutely, people are taking it more than food nowadays.
Exactly. I've got some cartoons where the person who owns Dolo or Crocin is sitting out in the Bahamas while everybody else is. So yes, so up to 4 times a day and up to 650 milligrams typically. Please do not self-medicate and start with antivirals and steroids and such medicines on your own. Again, age-old common sense precautions or things like warm water gargles, steam inhalation if you've got a runny stuffed nose. Be well hydrated, just simple home remedies like that. And if you've got fever which is persisting, definitely talk to your doctor. In terms of when are the warning signs, when do you potentially need to go to hospital? Now here, if you've got fever which is not really coming under control with paracetamol, it keeps rising. As a rule of thumb, if you've got more than 100 degrees Fahrenheit for more than 3 to 5 days, that might be an indication. Shortness of breath, which might suggest that you've got the Delta variant. If your oxygen saturation drops below 94%, and I don't suggest you test it, every few hours like we used to when people had Delta, but at least once a day. If it's normal, that's fine. If it's not normal, then check it more frequently. Anything out of ordinary, things like chest pain, chest discomfort, because Omicron also affects other systems. So people who have pre-existing diseases, we have found that this somehow, Corona tends to tip them over the edge in a manner of speaking. If somebody's confused, their orientation is not so good, then they need to, consider hospitalization. The other, what we call co-morbidities, and again, that's a term which everybody suddenly learned very quickly over the last 2 years. Everybody says co-morbidities, the usual suspect, diabetes, especially uncontrolled blood pressure, extreme overweight, obesity, those, age over 60, 65. Again, everybody over 60 is not automatically at risk, but when, put together, it sort of adds up to the constellation of risk. So these are some warning signs and conditions which you need to be aware of to consider hospitalization.
So we've now moved, when you talk about hospitalization, Dr. Contractor, we've now moved from alcoholic cocktails to medical cocktails. So I mean, how does this work? And I just want to know that, are we really over-treating ourselves as well? Because, one of the things, because we are scared from the previous experiences, a lot of this is also self-limiting. Getting the right type of treatment is also very important. There are people who are dying as well. It's not that they are not. Yeah. So we have to be very, very careful. But where do we draw the line?
Yeah,
And where
that's
do
a
we make
great
sure we
point.
don't
Again,
over medicate? We just
yeah,
don't
again,
give antibiotics, left and right, give steroids left and right,
Yeah.
like what happened earlier.
Yeah.
This is a different wave, so I think we should recognize it and we should treat it accordingly as well.
Absolutely, well said. And like I said earlier, there are almost two extremes of people. Those who at the slightest sort of issue will take the highest degree of medicines, and those who even require medicine and then they're sort of refusing it. So you don't need to be obviously at either end. In terms of cocktail, worldwide, there are three sort of, if I may say, sets of cocktails which are being used. One was made by Eli Lilly and the other by Regeneron, which President Trump had taken. And the third is a medicine called Sotrovimab. Now, Sotrovimab, as far as I'm aware, is not available in India currently. The earlier two cocktails, which was by Regeneron and Eli Lilly, were found to be much more effective against Delta. Against Omicron, they have not found to be as effective. So those would need to be taken extremely judiciously. You need to talk to your doctor who needs to consult with an infectious disease chest specialist and really decide that are these cocktails for you, especially if you know you've got Omicron. So you can try and do some sequencing and figure that out. And Sotrovimab, which is shown to work against Omicron, is not currently available. Similarly, with the antiviral drugs, there are two which have been approved. One is by Merck called Molnupiravir, which is now available in India. And the other is called Paxlovid by Pfizer, which, as far as I'm aware, is not available in India currently. So Paxlovid, the Pfizer one, has shown to be extremely effective against Omicron. Molnupiravir was shown to be fairly effective against Delta, but not so much against Omicron. So again, whether you're taking these antivirals or the cocktails, please use them judiciously. Talk to a doctor who understands them, talks to you about the side effects, the drug interactions, and then decide whether it's right for you.
Yeah, because again, some of them are saying that they're not really so well proven, and also that the fact that they may have side effects in the long run.
Exactly.
So one should be careful, and again, one should only do this under medical advice.
Yeah, especially women of childbearing age.
Yes,
they should not conceive if they're on more. I mean, within about 3 to 4 months of taking Molnupiravir. That's an important one.
True. I'm glad we pointed that out. What is your opinion on kind of home remedies and alternative medicines, also in COVID and in Omicron particularly?
So I think let me just answer a very small bit of the question, and then I'll hand it over to the master himself. But here's the thing: when we talk about simple home remedies like steam, inhalation, gargles, etc., they certainly are effective. Taking Ayurveda, homeopathy, all of those, honestly, I don't have enough knowledge to be able to comment intelligently on it, and I'm speaking to the master himself, so it would be great if you could enlighten us.
No, I'm saying there are, Ayush has presented lots of kind of clinical proven remedies which can help in prevention, and also in the early stages. So we have medicines in homeopathy, for example, like arsenic Al-30, and they prescribed, for 2 days, 3 consecutive days to kind of prevent COVID from spreading. And we did that in the first and the second wave, where we had distributed lots of them free of charge also to the police force and to lots of other NGOs as well. And it is very, very effective, but only in the early stages. And of course, again, it's a thing of proximity. If everybody's living too closely together, they're coughing into each other's face, then really nothing can help. But given a certain condition, yes, it is helpful and worth trying. And so also there are some Ayurvedic medicines as well. I think in the early stages, particularly now in Omicron, because it's symptomatic and not so severe, I think, in the early stages, homeopathy medicines according to the symptoms can actually help very much. That's for sure. But I think the important thing is where you should know where to draw the line. Correct. Because, I've seen a lot of alternative practitioners then trying to treat almost everything. I think it's important to make sure that beyond a point, you draw the line and then you hand over the patient to a hospital or to an institution for proper care. That's very important.
I think medicine today should be complementary rather than alternative. I mean, all systems of medicine have a place and they should be used judiciously. I don't think everything should be either or.
Yeah, there's a move across the world to have integrated medicine.
Yes,
exactly. And I think we're all moving towards that.
Yes.
Now coming now to, we are part of IMC and, we are also a business kind of organization. So let me just talk about a few things. Number one is the long COVID. what is the long COVID effect? What are the kind of symptoms that last, and how do you deal with it, especially because you are focusing so much on rehabilitation?
Yeah.
And then let me come to another part of the three important parts of post-COVID care. One is emotional care. We've seen lots of patients suffering from anxiety, depression. There is almost 24% increase of anxiety in the second wave, and depression of patients. People have committed suicide as well. So how do we deal with this? How do we recognize it? What do we do? In mental and emotional health. Then, of course, there's a financial loss. $3 trillion was lost, in the economy in the second wave, and almost 30,000 crores was lost during lockdowns per day, even in India, in the first and second wave. So it does have an economic impact as well. So how do we deal with that as well? It's lives and livelihood both together. And the third, of course, is the social fabric, because families have been broken, they've been isolated, children have been out of school. Are they developing well or not? Not getting the right kind of education in that sense. What about frontline workers? Is there not too much of strain on them? Because if half of them are not reporting to work because they are sick, how do we deal with all of this? So just the same question in two parts.
Okay.
First the complications, and then the effects of it.
In terms of long COVID, obviously Omicron was only sort of identified, if I might say so, at the end of November. So there isn't enough data to look at what will be its long consequences. But we know of the earlier strain that there were people, and ironically, it's not just that the people who suffered very badly had long COVID. There are some who had even mild symptoms, but they just continued for a long time. And there are three areas which were affected. And here I'm talking about pre-Omicron. That's an important sort of point to make, because again, Omicron's not been there long enough to talk about long COVID. So it affected the nervous system, the central nervous system. It affected the heart. People sometimes got a condition called myocarditis, which is sort of inflammation of the heart muscle, and it had long-term effects on the lung as well. So the commonest complaint that I have seen directly working with patients is that they complain of fatigue, most of them. And they say that fatigue has not, if I might say so, left their body. And some were there for a month, some were there for 2 months. When I'm talking about 1 or 2 months, I'm not talking about hospitalization. They may have been, in hospital only for 2 or 3 days, but that fatigue persisted for a very long period of time. Again, if we slowly work with them and build them up, 9 out of 10 feel okay. Some people complained of a term that they call brain fog, where memory was affected. We found that their cognitive tasks were slowed down. So all of these things are also affected.
So how do you deal with them? How do you, because you're part of rehabilitation team, what do you do? What are the 3 things that you would recommend to people to do? Like, for example, breathing exercises, meditation. Correct. What would you recommend?
Yeah. So in fact, we made a nice video, which I'll share with you, and if it's appropriate, maybe IMC can sort of share it. We focused on 3 to 4 different areas. One is the physical part. So you start getting a person moving, start getting them literally, as I use the word, moving, walking, and then slowly getting back to where they were. That's the physical part. Then we focus on nutrition. Many people have lost a lot of weight during that time. So, getting back in a correct manner, healthy nutrition. Then we talk about the mental health part of it. The psychological part. So we also use yoga, which helps both for breathing exercises as well as from a sort of a meditation and mental health. And I think this mental health bit has been ignored. I think we're undergoing an epidemic of mental health. One little silver lining, if I may use that phrase, is that it's being recognized now. People are openly talking about mental health. I know that in the hospital I work and in the larger parent company that I'm part of, we're doing a lot of sessions, a lot of seminars, talking about mental health, asking people to reach out, and people are talking more about it. To prepare for this talk, I went online and did some research. There was a study published literally last month. Amir Syed was the first author, where they spoke that what they found that the people who were most affected were people in the private sector versus the government sector from a sort of a mental point of view. Women who were working were more affected, and those in tier 1 cities were affected more than tier 2 or tier 3. So women working in the private sector in tier 1 cities somehow were most, and it makes to some extent an intuitive sense, because the women who work in cities like Mumbai, the working women are literally super women, right? They're working from home, they are running the house, their children are working from home, 2 kids are going to school online.
More pressure from all sides.
Yeah,
also,
absolutely.
I think the private sector is more pressurized in times like this rather than government jobs. So
yeah. So I think, and now there's also what I call pandemic fatigue, not just the physical fatigue, but just sort of the now there are people whom you see, sometimes you meet them socially, oh, don't talk to me about COVID, so I think it's an interesting time, and I hope that we can all sort of stand by each other and support each other and get through it.
thank you. That was really very, very useful.
Yeah.
2 final questions, and I don't find any questions on the chat, so either everybody's understood everything or nothing at all. So I was just looking at if there are any questions that they'd like to ask us at the end of this talk. But 2 final questions from my side. The first is, are we actually ready for another episode or onslaught which may come? Not this one, but this one came after 100 years. But are we ready for it really? I mean, are we not just looking at band-aids? Are we just looking at immediate benefit? Should we not overall use this opportunity to overhaul the entire medical system? To increase the number of doctors, the paramedical staff, the infrastructure in the smaller cities as well. Should this not be really one of the larger aims of all governments and all countries?
I think you absolutely sort of hit the nail on the head. That this is calling it a wake-up call is euphemistic. It's like a massive slap on the face wake-up call for the whole world. We tell people that if someone had to make up this story or make a sci-fi movie, prior to 2019 sort of December, even by standards of science fiction, this would seem completely unbelievable. But here we are, sort of living it. So I think the point you make is absolutely correct. Public health has been neglected far too long all over the world. It's not just in our country. I think it's all over the world. Things like preventive and social medicine. I know that when we were studying, preventive and social medicine was often the last choice in postgraduate medicine that people would take. And a country like ours, where there's so much need, I mean, there should come a day when it's not the last choice that people take and people make. I think corporates are waking up to this. I think during this whole pandemic, we saw corporates really standing by, helping the government, and many of them helping their own employees. And I think it's also an individual wake-up call that things like taking care of your own health. It was clearly seen that people whose lifestyles were healthier tended to have less severe COVID than people who had things like uncontrolled diabetes, blood pressure. So I think it's a wake-up call for the universe. And the final point, I think it's a wake-up call for collaborative care. Ironically, we would have thought that by now, getting into the 3rd year of what you correctly said was 2019, by now there would be greater collaboration, but there isn't. The WHO seems to be, almost, I don't know the right word for it. The US CDC, which was, so respected, now seems to also be coming out with, contradictory role. Europe has not stood anywhere in this as a sort of a bulwark. So I think I don't know whether it's time for the WHO or another world body like WHO, which is focusing on infectious diseases, to really stand up and be counted and to have better coordination.
Thank you. There's a question from Ajit Panekar. Hi, Doc. Post-COVID, what's your advice for marathoners? How do we get back to long-distance training? Now he knows that you've done the cycling, and collected 1.2 crores for charity. Well done.
My God,
congratulations.
You got a great memory, sir. I think the idea is that you need to build up gradually. I think it's not the mistake people make, especially people who are into high level sport, is that they're so desperate to get back. if they've had a 2-week break, they will try and get back to where they were before the break. Don't do that. After your COVID break, take at least 3 to 4 weeks to get back to where you were. One common issue that sports people tell me is that for the same level of exertion prior to COVID, after COVID, their heart rates tend to be higher. So maybe be a little more alert about, monitoring your heart rate in the initial few weeks after you get back. But simple rule of thumb is start very gradually and then build it up. I promise you, you will get back. It just might take a few weeks.
There's a question from Pradeep Gujarati. Dr. Contractor, very nice info. Thanks. Are kids and teenagers safe? Do they need a vaccine? Whether schools and colleges should reopen?
Okay, so Pradeep Bhai, I think, when you say are teenagers safe, that's a difficult question to answer. I will say yes and no. In terms of they can catch COVID just the way any adult can. So it's not that they cannot. The good news is the data so far have shown is that there are, compared to adults, they have less long-term suffering, less severe disease, less death, etc. It's not that no children have suffered. They have, and many, unfortunately, are immunocompromised. Those who have different types of cancers and things like that, they definitely have suffered. I would give the vaccine to my child when their turn came. I gave it to my niece when her turn came, a few days ago. I've given it to my daughter when her turn is there. So I certainly would give it. And
thank you.
About schools, that's a very, very, very hard question to answer. And I've just been reading debates, and people can, go both ways. I agree that children are having a very, very hard time staying at home, but we've got to figure out some kind of a balance between schools opening up and infection spreading rapidly, especially in this wave. I think in this wave in Mumbai, till the absolute peak is hit, which let's be hopeful is in a couple of weeks, we should remain closed since we remain closed so long, and then open up soon after.
Thank you. There's a question from Ajay Kumar. When should a COVID patient take a booster?
So again, the rule of thumb is, and again, there are different guidelines on this, somewhere between 3 months or so after the infection. This isn't a set in stone kind of a thing. You'll find different people suggesting anywhere from 2 to 6 months, but that's the range they talk about.
Thank you. Mr. Korakila wants to ask a question. Over to you, user. And maybe this will be the last question. We then close up. So,
yeah, thank you, Mukesh, and thank you, Ashish, for covering such a huge area of this pandemic. I'm currently a COVID victim as I speak to you, but I'm all right, asymptomatic.
Great.
But when I got my reading, which said positive, there is a CT reading which said 23. I do not know what it means. That's point number one. Secondly, the thought is that while we say this Omicron virus is a milder one, more transmissible and viral, but is there any data to suggest that a person like me and many others who have got double vaccinated are feeling asymptomatic? What if I had not taken the vaccination at all and I was subjected to Omicron? Would that have been the same symptoms, or would have been much more different? So that data, the hospitalization rates are very low, but are the people who are getting infected are all double vaccinated, and therefore we say it's the mild variant? One doesn't know what is really the truth behind it.
Yeah.
Secondly,
yes.
Lastly, Dr. Fauci has said that this virus is going to stay forever. Now, does it mean that we're going to wear masks and have social distancing for the rest of our lives, or how is it going to pan out? So these are my just broad areas. Thank you.
Okay, thank you. So firstly, I hope that you get well soon. I'm happy to know that it's very mildly symptomatic. So please recover fully. Your first question was on CT value, and that's a very hot topic which everybody discuss and talk about. The word CT stands for cycle threshold. It's just a technical term as to how many cycles do they need to run in the lab. I'm using simple language to actually detect the virus. So if there's a lot of virus, then you have fewer cycles you need to run to detect it. So the higher the CT value, in a manner of speaking, the less virus there is. But and to detect it, different countries have different threshold. In India, we're using 35. So if the lab runs it and it is 36, then they would label you as negative. If it is 35 or lower, they would label you as positive. More and more doctors are discouraging you from using this value with any meaning, because a lot matters when it was picked up. So if you had tested, say, 6 hours earlier or 10 hours later, the value may be different, because again, it might, the virus will sort of go up and come down. So we don't know at which level we're catching it. You had said yours was 22, 23, that's sort of somewhere in between, but do not lay a lot of emphasis on it. Once it crosses 35, it will be labeled as negative. That's the CT value. Your second question was related to if you had not taken the vaccine, what would have happened? So firstly, I'm very happy you've taken the vaccine, which is why you had it so mild. So, you know, in the initial days when people were saying that the virus is mild, there was a lot of argument saying that it's not necessarily mild. It's just that the virus is now hitting a wall of people who have had double vaccines. Some of them had, very few in the world had 3 vaccines, and many people had already been infected. So it's, you know, 2 vaccines plus infection is sort of like a booster. So the virus is hitting a much stronger enemy compared to what the original virus or Delta hit. And it's still early days, but so far the scientific thinking is that genuinely the virus is also less, if I may say, virulent or harmful. So it's a combination of it hitting a strong force that we are protected now, and it's also less virulent, thank God. And often this is the way through history pandemics and viruses cycle. So when Dr. Fauci also says that it will be there forever, that's when it becomes what's called endemic. To give you a classic example, tuberculosis is the most endemic disease in India. You don't have tuberculosis rampant all over the world, but in India it is. So we live with tuberculosis. That doesn't mean we really change our daily life. So at some point, we might, or we will live with different types of coronaviruses, but they may not be as deadly. Hopefully no other virus will come which is more deadly. And your last question, you know, I am not Nostradamus. It's very hard to predict when this will be over. But again, from everything I've read and understood, it will get over. I don't think that the way we've lived our life in the last 2 years is the way we are going to live our life forever. By no means. It is going to be over. We just need to be vigilant, as Dr. Batra said, also build up our public health systems that, God forbid, should something like this come again in the future, we're much better equipped to deal with it.
Thank you
very
so
much. Thank you very much, Dr. Contractor. That was such a wonderful talk. I think you've given us a lot of hope finally. And let me end this session by thanking you and thanking IMC as well for this opportunity. And for all the people who've joined in, I hope that you've gained a lot of information from what Dr. Contractor has said. And I hope that you'll all benefit from it as well. Thank you for joining us. Finally, as they say that, the word Omicron has the word Om in it. And anything which has the word Om or God in it, God willing, we shall all be free from it. So inshallah and God willing, we will all look forward to much happier times. Thank you very much for listening in and for joining us. Thank you.
Thank you so much.
Thank you, Dr. Batra. Thank you, Dr. Contractor. It was really an interesting session. So as we come to the close of this wonderful, knowledgeable, interactive session, may I request Mr. Anand Singhania, Vice President, IMC Chamber of Commerce and Industry, to propose the vote of thanks. Over to you, Mr. Singhania.
Good evening, everybody. Good evening, ladies and gentlemen. Lovely to see you, Dr. Ashish and Dr. Batra on Zoom. It's my privilege to propose this vote of thanks at the end of this very interesting, intuitive, and highly knowledgeable session. With almost 20 million new COVID cases worldwide in the past week alone, which is unfortunately up 40% week on week, Omicron has become the most infectious variant of concern over the past 2 years. The handling of the COVID pandemic by large world economies is changing ever so often. The US recently revised the testing norms for the RT-PCR test. UK, on the other hand, is disbanding the need for a pre-departure test significantly, and Spain is planning to label the COVID as an endemic, a flu-like virus. Closer to home, the widespread use of home testing kits for COVID is leading to underreporting of the number of cases and resulting also, according to me, in less COVID-appropriate behavior across household and commercial establishment, which I think is something to be concerned for. So today it has been a very unique and insightful session, and I hope that all of you have made notes of the important learnings that were discussed to be safe in these trying times. I truly believe that today's session has empowered us to make fruitful decisions to have a safer future. On behalf of the IMC Chamber of Commerce, I wish to express our sense of gratitude to our eminent speaker, Dr. Ashish Contractor, and our moderator, Dr. Mukesh Batra, for gracing the occasion and sharing their valuable expertise. I must thank all the participants for being so interactive with their questions, and Dr. Batra for drawing the best out of this session from our speaker. Sir, your presence has been a source of encouragement to the chamber. I would like to also thank the IMC team for all their support, and thank each one of you for contributing to the success of this event. Like they say, good health is the best wealth. Stay safe and take care. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.